name is Dr. Sanjay Hapani, and I'm a medical oncologist. I've been working at OKCIC Indian Clinic for last about 2.5 years now. I personally treat all types of cancers. At Indian Clinic, the more common cancers that we are dealing with is breast cancer and colon cancer. There are about 280,000 cases of invasive breast cancer which are possibly harmful to patients in United States in 2021. And there are about 50,000 non-invasive breast cancer in 2021. Those have a potential to become problematic, but they are considered stage 0 cancer. You can diagnose many more stage 0 if you are doing mammograms regularly instead of finding somebody at stage 2 and 3, because stage 0 has 95+% cure rate. Stage 1, 2, and 3, which are invasive cancers, the cure rates start to decrease. So doing screening does not prevent development of cancer, but it probably catches it at an earlier stage to avoid treatments like chemotherapy, radiation, and all those things. And it can be just managed with operation alone. Preventive screening, most of the recommendations in United States are based on United States Preventive Task Force recommendations, and the recommendations have been variable over time, but average starting at 40 years with no prior personal history of breast cancer or family history of breast cancer would be an ideal age to start mammogram. And then those who have family history, they should talk to their doctors about possibly doing them earlier. Over time, we have actually created a really good opportunity for Native American patients, because they were probably not getting the best care because of a lot of holdups in getting the tests done, referrals, and everything. So having case manager is more like a quarterback for that patient. Everything kind of comes through that quarterback, and that quarterback will then direct the care, which is done the fastest, time efficient, and patient is no longer lost in the system to doing tests here and there and then don't getting the records. And me coming on board at the clinic, we are basically keeping track of those patients, rather than one went to Integris, one went to St. Anthony, one went to OU, Mercy, and then there is no follow-through, and those patients were falling through cracks because of needing a lot of referrals and all those things. With case manager, that loop has been closed. Benefit coordinators come in, help out a lot of patients who qualify for free insurance many times, and they just didn't know about it. So at least 4 or 5 breast cancer patients in last 2 years that I've met, they actually had a free insurance, Obamacare, and they had to do nothing, just apply. But they were hesitant, not aware about it. And when the benefit coordinators jump in, they were able to secure those services, and patients could go anywhere after that. So we have a lot of success stories, because breast cancer is curable if they're diagnosed at stage 0, 1, 2, or 3. We actually met a patient who was stage 4, and the success is not in form of cure, because patient is still getting active treatments. But she presented with severe pain in her neck, and she had actually bump on her breast area that at age 60 they thought she has abscess. So patient had not had any mammograms or anything done, and then eventually it turns out to be stage 4 breast cancer. We put her on the newest treatments. Those are available, they're cutting edge, and this is almost 2.5 years, because I met her at the beginning of my journey with the clinic when I started, and she is functioning as normal as can be, no hospital visits, no emergency room. She comes to us every 3 weeks for an IV treatment for an hour or so.